You've heard of socks before, but have you heard of compression socks? I'm Dr. Paul Zalzo.
I'm Dr. Brad Weening. Welcome to Talking with Docs. We have a guest today, Dr. Bev Chan, vascular surgeon, expert in compression stockings, and many other things.
We're going to tell you quickly what they are, why we use them, and we're going to tell you how to put them on because they can be a little bit tricky to put on. Are you wearing compression socks?
I literally am wearing them, and it's because of Dr. Chan's video that we did before about varicose veins. She changed our lives.
I'm not wearing them, and I feel bloated.
Oh my God, you totally should.
Okay, so Dr. Chan, compression stockings, we've talked about them before. Lots of patients talk to me about them, and they think, are they really necessary? Do they work? Do they even do anything? Because they're hard to get on.
They are hard, but it's definitely for a lot of individuals, it's really helpful.
Okay, so it's worth it. That's the first take home. It's worth it, so keep listening.
Yeah.
And so as the name suggests, they are stocks or stockings that offer compression to augment your veins' ability to push the blood back up to your heart, right? And what kind of pressures are we talking about?
So medical grade typically start at 20 to 30 millimeters of mercury. So it's tighter at the ankle, not as tight up at the knee level or in the thigh level. There are tighter ones too,
Okay.
but that's the most common.
So millimeters of mercury is how we measure pressure, and they're graduated. So there are higher compression in the bottom and then less compression as you go up. And that helps push the blood up.
Okay.
Just as the name implies, compression stockings. Okay. Now, when would you use them? Who uses them? Who needs to wear them?
So
Aside from Dr. Weening.
yeah, anyone who stands for long periods of time, sits for long periods of time, traveling, if they have varicose veins, venous disease, lymphedema, lipedema, so
Pregnancy sometimes?
Pregnancy for sure.
Right.
So definitely about occupational hazards of standing for long periods of time for sure.
Okay, so that is generally most of us have this type of job. Either you have a job where you're sitting
So
or
if you're a
standing.
human.
Yeah, unless you have a job where you're lying down. So you want to wear compression stockings to augment your veins' ability to bring the blood back up. So just about anybody qualifies to wear compression stockings.
Okay, where do you get them? So you could get them, I'm assuming, over the counter. You could get a prescription from your doctor. What's the difference between those two types of compression stockings?
So over the counter, they're the non-medical grade ones.
Okay.
So they're usually a lighter compression. It's 15 to 20 millimeters mercury.
So maybe a nice place to start, but maybe
Yeah.
not enough for some people with
Yes.
more significant pathology.
Yes.
Okay, are they usually cheaper then too if you're buying them over the counter?
Yeah.
Yes, and a little bit less reliable?
Yes.
It's like most things in life, right? if it's cheaper, it's probably not as good.
You get what you pay for.
Get your paper.
All right, now here is the million-dollar question. How do you put these things on? They are tight, right? That's the purpose of them, to offer compression. So imagine trying to pull one of these things on. It's not easy, and a lot of my patients complain about this all the time. I'm like, are you wearing your compression stockings? They're like, no, they're too hard for me to put on.
And I literally thought of this morning as if I'm on, I thought, there's gotta be a better way. Maybe I could get like a little mini trampoline and I could jump into them. They could be held out somehow. And I thought, it's probably not practical, but
Yeah.
how do you tell people to get them on? Do you have any tricks and tips?
I like telling patients to flip the compression stock inside out.
We actually have a video of Dr. Chan showing someone how to do this.
Okay, let's look at it.
We're gonna look at it right now.
So you start with flipping inside out.
So just that the foot and the ankle part is not.
Okay, so the first thing you do, step one, turn the stocking inside out. Counterintuitive.
I don't do that, but now I'm going to. Tomorrow I will do
Really?
that.
And then I like wearing gloves. So the best gloves are the ones with little grips. So sometimes the places that sell the compression stockings will have gloves, or dishwashing gloves, or gardening gloves. They have little grips.
Because the material is a little bit sheer.
Yeah.
Yeah. It's not like a normal sock, really. The material's different.
Yeah.
I actually had my underwear on inside out once. And I was in didn't realize till I was in the change room changing.
Okay.
Bad time to realize that.
And then with the gloves,
you?
so you don't
True
tear.
story.
And then you just pull it on.
I wasn't
And
wearing gloves.
you shimmy the stocking from the bottom.
Okay, so we've got turn the stocking inside out, wear some kind of rubber gloves to get a better grip, and then don't pull it from the top. Shimmy it up from the bottom.
Yeah.
Do you do house calls to
Oh,
for
I have
people's
patients that ask us that can they come in and put it on, but then sometimes we teach their spouses to help them.
Oh, that's a good idea.
So
That's
get
kind of
someone
a-
else to help you as well.
Yeah, it's a bonding thing you can do with your partner.
Yeah.
Put on each
Yeah.
other's compression stockings.
It
Yeah,
is.
for sure.
Yeah, go to the movies tonight. Why don't we just put on each other's compression stockings?
Okay. Yeah, followed by our mouth guards and our CPAPs.
Oh, man.
It's a date.
That's the
Yeah.
date.
All right.
Okay.
So those are probably the three most important things. Turn it inside out. Wear some kind of gloves with a good grip on them, and don't pull from the top. Why don't you pull it from the top?
Just because at the top, for the thigh highs, there's a rubber compression or like a silicone elastic, and it's a little bit different from the rest of the material. So when you pull from the top, it tears right at that spot.
It's like a weak junction kind of.
Yeah.
Yeah.
Okay. So don't pull it. You got to shimmy it up.
What do you tell people in the summer? Because I was talking to some patients yesterday about this. Like, oh yeah, I wear them, just not in the summer. And I'm like, so you don't have like venous disease in the summer?
It's
of course you
seasonal.
do.
It's tough.
It's just hard, right?
It's really tough, and
Yeah.
a lot of patients cheat. I'm not
Yeah.
gonna lie.
Like you're in shorts and you got your knee
Yeah.
highs,
Yeah.
your thigh
Well,
highs.
it's got the Bermuda short.
Right?
Yeah.
Right? Well, Brad wears his on the beach.
Yeah,
He
that's-
doesn't care.
No,
I got venous disease.
That's
I got to
it.
wear these.
Gotta be just-
Strutting on the beach in his Speedo, wearing his compression stockings.
Okay, so the take-home message is if you have swelling in your legs, compression stockings are a great option. Over the counter, obviously, if you either don't have benefits or can't afford the more expensive ones, but the more expensive ones that are stronger are going to provide more relief for you. Wear them as much as you can, obviously within practical limitations. And if you need help, you can use the tips that Dr. Chan has provided today, or get your partner to help you.
And there's a million reasons why you might need to wear compression
Yeah.
stockings.
There you go. Now you know all about compression stockings. If you like this video, please like it. Subscribe to our channel. Leave a comment about your experience with compression stockings.
And remember, you are in charge of your own health.
And thanks to Dr. Chan for joining us and sharing your wealth of knowledge, Bev.
It's my pleasure.
We'll see you next time.